When I typically worked in the ICU, I had 2 patients. Now that during a COVID pandemic, we were told we have to take 5 patients, 5 critically ill patients at one given time.
Sue has been a nurse for 17 years at Jamaica Hospital. We're obscuring her face. She's fearful she could lose her job for speaking out.
And I remember in a huddle, the manager said, "Oh, we have 100% death rate with patients on event." So one of the nurses said, "So you mean to tell me every patient that comes in here on event leaves out in a body bag?" And he said, "Pretty much, yeah."
And patients weren't the only ones sick and dying.
We are short-staffed because nurses have contracted the virus and they've been out, and some have passed away.
But we don't know how many. Neither Jamaica Hospital nor the city or state would give us the number of nurses, doctors, and other workers at Jamaica or other hospitals who've been sickened, recovered, or died. New York City Health and Hospitals, which runs 11 city hospitals, reported 26 workers have died. But Sue knew the death toll was rising when they closed the street and filled it with refrigerated trailers to store bodies. She says the hospital was flooded with patients, one day working from the ER.
Look and see how many more ambulances I had to triage. I had them backed up for 2 blocks.
And that overcrowding put patients too close to each other.
And you had patients, COVID patients mixed with patients that came in for chest pain. You had patients anywhere they can put them.
Even the most vulnerable, the elderly, were not kept away from COVID patients.
If the patients fell in a nursing home, they would come to the ER. A lot of them would end up with the virus.
Which could also explain why Queens has the highest citywide death toll among nursing home patients. Now Sue is desperate for change and protocols for treating COVID patients. She also works at a Bronx hospital where she sees different treatments leading to patient recovery, including low-tech methods like IV vitamins and turning patients over to help clear their lungs.
At Jamaica, they wasn't using vitamin infusions. Why the patients are not on vitamin C? Why they not on thiamine? Why they not on all these other vitamins so that they can help their immune and boost their immune system? One pharmacist said to me, "Well, we have to pick and choose who get the drugs."
She's also hopeful ventilator use will change since so many who go on them never get off alive.
There got to be a better protocol. It can't be like this. I mean, every time somebody's short of breath, you're putting them on a ventilator. But nobody prepared us to watch this many people lose their lives to this virus.
The takeaways on this: get data from the hospitals to see which protocols are working and then deploy that citywide to save lives. Also, it's imperative to keep those COVID patients segregated from otherwise healthy patients so as to not cross-infect and increase the death toll. We reached out to Jamaica Hospital for comment, but did not hear back. Reporting from home, I'm Kirsten Cole, Pix 11 News. Back to you, Betty.
Just astonishing.